Hey guys, now we're going to go over the second part of chapter 31, sleep. First, by finishing up insomnia, the outlook, the prognosis is good for those that do follow the treatments for it. So moving on along with that, something that often accompanies daytime sleeping or insomnia is daytime sleepiness. And in this chapter, it's kind of divided into three major disorders and a couple bulleted pointed ones. So we're going to start with the smaller ones first. Excessive daytime sleepiness is one of those, and it's usually caused by other sleeping disorders like insomnia. Not always, sometimes it's unknown, and sometimes it can be a symptom of a systemic disease like kidney failure, depression and isolation. They can have just being less physically active will lead to sleepiness during the day, so it kind of throws off their rhythm. Next, we have the REM sleep behavior disorders and other disorders, which was briefly discussed in the end of the chapter. So REM sleep behavior disorders is it's described as a thrashing from dreams. So unlike just moving around like normal, it's a very violent thrashing. So it seems to be one of the more dramatic of the conditions found. It can be caused by a multitude of things: alcohol, drugs, tumors, anything that affects the brain that could affect the circadian rhythm. Can affect that. The treatments are usually there's something causing it, so if you treat that, that'll usually fix it. Otherwise, low dose benzodiazepines have been known to be very effective. And then other disorders that are far less common in the geriatric population are night terrors, sleepwalking, and narcolepsy. And they're discussed as something that usually happens earlier in childhood, maybe into adolescence, and usually clears up. But if it does happen in geriatrics, it's usually a follow-up with that thing. Or it's usually a scene in childhood that leads to that in geriatrics. All right, so now for the first major one, we're going to go over limb movement disorders. And there's three basic types. The first type is restless leg syndrome, then you have periodic leg movements, and then you have leg cramps. And I kind of bunched them together because they kind of put restless leg syndrome and periodic limb movement together in a few things. So restless leg and periodic movement, they have some very similar causes, including low iron, chemical imbalances, and also sometimes they don't know what causes it. And then leg cramps is usually something to do with dehydration, electrolyte imbalances, diuretics, but the most common is also they don't know why. By the way, the difference between the two, restless leg syndrome is when you have the feeling, it's kind of like an itchy or rub, and the person describes it as they're not going to be comfortable until they move the leg or the limb. Periodic leg movement is usually something that isn't noticed by the patient, it's noticed by their partner, but it's just movements of the limbs during the night that's abnormal. For diagnosing them, usually restless leg syndrome and cramps, the patient's going to know and they self-diagnose. For periodic leg movement, it's usually brought up by the partner themselves and they describe it pretty straightforward. All right, so to treat these, again, all of these are pretty similar in all of them. They mention that if you're stretching the muscles, taking hot baths, if you have anemia, then take an iron supplement. Anti-Parkinson drugs have seemed to help, and then hydrating to deal with cramps is a way to treat that. The outlook for all of them said it was pretty good. There's a few minor things in each of them, like in restless leg syndrome, it can get worse with age, whereas in periodic leg movement, it can actually be something that they need to treat indefinitely, that they need to stay on some sort of drug regimen to treat. And then in cramps, usually that will auto-resolve, so it's got real good prognosis for that. It'll come and go. Again, they don't really know why. Next up, we're going to have sleep apnea, which is a really common disorder. It's defined as a temporary interruption of breathing, especially while you're sleeping, so the person will actually not breathe for a minute. It is caused by a multitude of things. The biggest one is going to be obesity and alcohol. Genetics do play a role, sometimes sleeping aids, some things that relax you so much that you actually have obstruction of a airway, like your jaw pushing backwards. But there's also a central sleep apnea, which is actually a chemical thing in the brain or nerve issue. That one they don't really know too much about, but that can also be a cause. And there's a third really rare one that is obstructive and central sleep apnea, which can be a real big issue. The diagnosis of this is usually when the patient comes in, they're usually going to be obese. They're going to have something that's like thick neck, or the tissue in their neck is thick. They're going to have a high blood pressure, and all these are usually going to be mixed with really excessive sleepiness because they're not getting the full REM sleep that they should, because their O2 levels are real low. Treatment is going to be is basically either treating the obstruction or fixing your lifestyle. So losing weight, decreasing your alcohol. They do make dental apertures to keep your jaw from, like if you sleep on your back, to keep it up and away from you. Surgery to remove some of the tissue in people with real thick tissue in the neck. And CPAP machines, which is basically a constant positive air pressure that pushes the airway open to keep it from collapsing. And then sometimes there's drugs that can help, especially with the central sleep apnea. The outlook for obstructive is okay. So it kind of depends on what the cause is and what you're treating, the root cause. As for the central version of sleep apnea, there's rarely a cure that will fix it. And lastly, the last major thing mentioned in this chapter is circadian rhythm disorders. So, as you know, circadian rhythm is your body's natural day-night cycle, melatonin regulating when you go to sleep, when you wake up. And the definition of circadian rhythm disorders is the disruption of that cycle. So it can be a lot of different things. And for that reason, there's a lot of different causes. One of them could be change in hormones, so going through menopause can cause that sort of thing. If you're going through multiple time zones, jet lag is technically a circadian rhythm disorder. If you're going through daylight savings, if you have a late night job, or if you're starting to lose your vision and you can't catch that bright light to help your body regulate itself, that will actually lead to a circadian rhythm disorder, which can lead to melatonin deficiencies and things like that. So the diagnosis is usually just seeing when they're sleeping and kind of going off of that. If it seems real late in the day that they're going to bed, or real early in the day they're going to bed, or if they're not sleeping at night but sleeping during the day, they can all be indicators that this is your diagnosis. The treatments are pretty straightforward. You're going to treat mostly the essential treatment is going to be good sleeping habits. So developing the body's natural pathways again to go to sleep on time and wake up on time, that is the essential part of the treatment. But you can also introduce melatonin in there to help with regulating that, or bright light therapy, which will actually use bright lights to stimulate the body during times that if you're falling asleep during the day, they'll stimulate the body with bright light to keep you awake so that it kind of fixes your rhythm back to normal. And with that, chapter 31 is finished.